We will be discussing the deadly cost of increased medications. We will specifically be discussing prescribed medications for chemotherapy, diabetes, and anaphylaxis treatment. We chose to include oral chemotherapy, insulin, and epinephrine. These medications are amongst the highest costs for consumers and puts them at risk for not following life-threatening treatment plans. We will discuss how the increased cost of these medications impact treatment and availability for our clients. Current trends in prescription medication costs are on the rise and are putting individuals in need of these medications at risk for not following a recommended medication regimen. The trend of increasing prescription costs will continue to rise in future years, putting our elderly population at risk of not being able to afford certain medications. The battle between Big Pharma and the insurance company puts consumers in the middle. Consumers are unsure how they will afford their medications, cancel needed physician appointments, and make adjustments to their household spending. A study of 4,015 telephone calls revealed that 45% of people that regularly took prescribed medications made adjustments to their household spending, including entertainment, groceries, and postponing other household bills. As you can see here, the quality of life is affected by the increased cost of prescribed medications. Even though more patients have health insurance and prescription coverage, the increasing cost of medication still interferes with other areas of life. High pharmacy deductibles, rising out-of-pocket costs, and other barriers are putting needed medical therapy at risk for our patients. Medicare and commercial health plans, no government body, including the Federal Trade Commission, the Food and Drug Administration, and the Centers for Medicare and Medicaid Services, has rules or laws that dictate or restrict the price of a pharmaceutical company can set for a drug. Insurance companies are to protect us from unexpected healthcare costs, and they work with drug companies to help reduce prescription costs. However, to cover the costs, they raise your deductible, raise your premium, and increase your copay or coinsurance. Evergreening is a tactic used by drug companies to reinvent an old medication into a new version by tweaking the old version or creating an extended release version, which increases the cost. Multiple drug companies compete by making the same drug. This should decrease the price. However, in recent years, some companies stopped making certain drugs, leading to the increased cost in raw material for the drug. Specialty drugs account for less than 1% of prescriptions, but represent 1/3 of drug spending.
There is a major issue with increasing costs of specialty medication. A systematic review was performed of drug life cycles in therapeutic drug markets, and it discussed several examples of therapeutic drugs that have become more costly over the years. This led to consequences that have impacted patients personally. For example, a medication used to manage chronic myeloid leukemia had tripled its cost per the FDA in 2015. Another generic medication to treat chronic hepatitis C, called Sovaldi, cost $84,000 for a 12-week treatment, or $1,000 per pill, and it had led to health insurance companies refusing to cover this medication. These high costs are leaving people struggling to adhere to their medication schedules because they are having a difficult time paying for them on a regular basis, or at all. This can be emotionally taxing on an individual. Due to the high prices, some insurance companies will not cover the medications, and some are not reimbursing patients. For example, individuals who need a medication for cystic fibrosis that costs $311,000 were being denied reimbursement. This creates even further financial and emotional distress on a person. In addition, this makes it harder to move towards the goal of creating universal health coverage when insurance companies cannot cover common medications. As prices of specialty medications increase and medication non-adherence is created, more patients may be seen in the hospital for acute conditions because they cannot manage their care on their own. This again leads to more hospital costs. Lastly, it's important to note that as costs continue to increase, some of the financial burden falls on taxpayers as their money contributes to the development of medications for illnesses like HIV and AIDS. There are minimal benefits to the patient when it comes to how expensive medications can be. On top of that, specialty medications such as oral chemotherapy, insulin, and epinephrine can be even more expensive compared to an over-the-counter medication or commonly prescribed medications. Increasing costs favor the drug manufacturer and the market. However, these high costs can contribute to the development of innovating therapies and new medications that can potentially benefit more patients. Overall, the medications help prolong a patient's life expectancy and help prevent the development of other issues. For example, for the medication used to treat chronic hepatitis C, it helped people avoid a liver transplant even though it was more expensive. Oral chemotherapy is medication utilized to weaken or kill cancer cells. This specific route is reported to have a more targeted action and can have fewer adverse effects compared to that of traditional cytotoxic chemotherapy. Additional benefits that oral chemo created was that it helped patients manage their own care by eliminating the amount of time spent in clinics receiving IV chemo. Patients who have the ability to take oral chemotherapy have more flexibility with their time, can travel, spend more time with their family, are not required to take off work as often, and have demonstrated to have a higher quality of life. Nevertheless, prices of oral chemotherapy have increased over the years. Within one study that was performed, the authors followed the trends of target oral anti-cancer medications, such as ones that help treat chronic myeloid leukemia, acute lymphoblastic leukemia, advanced renal cell carcinoma, non-small cell lung cancer, and pancreatic cancer. They reported that by 2012, the cost of TOAMs as per patient per month has doubled compared to 2007. The study also reported that before 2010, the cost per patient per month had increased from $3,000 to $6,000, and after 2010, it had increased from $8,000 to $10,000. This was an inflation rate of nearly 12% over 2007 to 2012. For patients with a Medicare D plan, their out-of-pocket expenses were below $980 in 2007 and above $1,200 in 2010 each month. If the current trend continues, they recounted that median out-of-pocket expenses would remain greater than $5,500 annually. Other studies have found that drugs such as imatinib and Novartis have tripled. Novartis has raised its prices from $31,000 in 2005 to $118,000 per year in 2015. The increased prices in oral chemotherapy medications has been reported to impact a patient's adherence to their cancer therapy. Because of these high prices, patients end up taking on the burden of having to pay for these medications or having trouble with obtaining coverage from their insurance companies. This can create financial burden, distress, bankruptcy, impaired coping behaviors, and lead to a lower quality of life. Insulin is used for diabetic patients to help regulate the amount of glucose in the blood and increase the rate of glucose transport into peripheral tissues. Insulin has many other influences in the body. On top of maintaining normal blood glucose, it can help glycogenolysis and gluconeogenesis and inhibit the breakdown of fats and proteins, which prevents the development of DKA. There are several types of delivery methods that can be used for insulin therapy, and there are advantages and disadvantages to each. We're just going to compare the common vial and syringe method with the pen method. A vial and syringe method allows an individual to drop more than one insulin, and sometimes it is less expensive than an insulin pen. Compared to the vial syringe method, the pen is more convenient. A person can bring the pen with them while they travel. There is less pain associated with it, and the pens allow for easier use and have more accurate and precise amounts, which may even contribute to better glycemic control. However, less people are using the pen because of costs and the amount of insulin available in each pen. The same article by Shaw et al. In 2016 reported that 80% of people in Europe use a pen, while only 15% in the US use a pen. The disadvantages to these costs are that it mostly interferes with the patient adherence because individuals have difficulty paying for their insulins. Medication non-adherence can lead to more health issues, hospitalizations, and even death. The cost of insulin depends on a variety of factors: the route, if different insulins need to be mixed, how many units are needed, a patient's weight, etc. In one journal article comparing the price of insulin vials to insulin pens, they found that outpatient charges of pens averages around $4,600 annually compared to vials and a syringe, which is around $5,300 annually. This is different from the last finding that said vial and syringes were less expensive. It's possible that the accuracy of pens leads to less waste, and therefore less insulin is needed. In this image, it shows the out-of-pocket expenses that have increased close to 10% between 2006 and 2013. Just to get an idea of what insulin can cost in 2019, Humulin N pen of 3 ml is $117, and for a 10 ml vial, it is $183. Humulin R 3 ml pen is over $350 and a vial 20 ml is over $1,800. An injection of epinephrine is considered the best method to promptly treat anaphylaxis and to prevent further progression of an anaphylactic episode. An epinephrine autoinjector, also referred to as an EpiPen, is beneficial for individuals who know that they have an allergy to a specific trigger, such as a peanut allergy, and can bring this medication with them wherever they go. However, for those who do not know their triggers or what will cause an anaphylactic reaction, will most likely not have access to EpiPen during the time of allergen exposure. More than 10 years ago, an EpiPen was $94, and now it is $609 for a pack of 2. Even with insurance, high-deductible health plans may leave a very costly out-of-pocket expense. Like the oral chemotherapy and insulin, when costs go up, it leads to non-adherence. But also, when costs go up for epinephrine and individuals with an allergy or history of anaphylactic reactions don't have it, they face extreme danger. Anaphylaxis and late treatment can cause death. In addition, when people do not have their epinephrine available, it leads to more hospital admissions, which places an economic burden on the healthcare system.
The government has started to help in some states. California enacted a law that consumers would not pay more than $250 for a single prescription per month, or $500 for certain high-deductible plans. We believe this is still too much for many clients in need of prescriptions, but it is a start. Currently, there are 4,300 generic drug applications and 15 new applications each month. Importing drugs from legitimate countries may decrease this shortage or help alleviate the cost of some medications. Obviously, getting drug companies to reduce prices will be difficult. Big Pharma has a right to make profit on their sales. Vermont has passed a law requiring drug companies to justify high costs and price increases. California is now considering this law. Consumers can be their own advocate on the high prescription costs also. Ask your physician for a generic brand of the medication they are prescribing. Do your research and shop around for the best price. Check out online pharmacies, however, make sure they are reputable. Change your insurance coverage to help reduce out-of-pocket prescription costs. Hopefully, these suggestions will help anyone that may have trouble paying for their prescribed medications.
So in conclusion, we've learned that specialty medication costs are continuing to increase each year. We've learned that drug companies and insurance companies are charging more, and some insurance companies are not covering the costs of medications. While there may be a benefit for increasing costs of specialty medications because it can lead to the development of new therapies, there's also major consequences such as non-adherence and a financial burden and emotional distress for individuals who cannot afford their medications. What should happen in the future is governments should set price limits on manufacturers and the drugs that are being produced. Nurses should help patients find availability for their medications and help them look for generic brands. We hope from this presentation that you were able to learn a little bit about the impact of specialty medication costs and what they can have on a patient as well as the healthcare system.